I did not know the symptoms of ovarian cancer. I did not know there was no test. I thought my annual exam covered all women's cancers. I did not know the treatments or the extensive side effects of ovarian cancer. I learned the hard way, and here's my story. I thought I was one of the healthiest women in Charleston. I don't remember having any symptoms or telling anyone that I had symptoms. I found a bulge under my belly button and went to my general practitioner. She reported it was nothing to worry about, but she recommended that I have it checked and repaired. I thought I was going in for a routine hernia repair. Suspicious tissue was found, and after it was checked and after a scan, the gynecological oncologist reported stage 3C peritoneal ovarian cancer. Within 10 days, I returned to surgery for debulking. Now, debulking is a terrible term. It makes you sound like a warehouse, but that is what it's called. And I left surgery much lighter as my uterus, ovaries, gallbladder, appendix, and even my belly button were removed, along with any other signs of cancer. A stomach port was inserted at the same time for IP, and that's intraperitoneal chemotherapy treatments. Within weeks of the surgery, I began a series of 6 aggressive chemotherapy treatments. The first chemotherapy was very traumatic for me. I had a severe allergic reaction. So they had to halt the treatment, give me an antidote, and wait until I recovered. And after I did, the treatment was again given, but with a synthetic form of Taxol called Taxotere. After the initial surgery and the 6 chemo treatments, I was elated to learn that the scan revealed no evidence of cancer. And I was cancer-free for 2.5 years. I was so aware that I might have a relapse, and every day I thought about the symptoms. And of course, every time I had a symptom, I thought the cancer had returned, and it did. Approximately 2.5 years after the initial diagnosis, my CA-125 blood test increased significantly. Something wasn't right. I did not have any other symptoms, so this blood test was an important marker for me. Scans revealed a tumor of the liver. At first, they didn't know if this tumor was a different type of cancer or if the ovarian had returned. I was originally scheduled to have surgery over the Christmas holidays. However, my gynecological oncologist shared the scans and the information with colleagues, and they came up with a different recommendation. They suggested that CyberKnife radiation be used to eradicate this tumor. This required 2 rounds of chemotherapy to decrease the size of the tumor, and then markers were placed around the tumor so that the CyberKnife radiation could be targeted. The CyberKnife treatments were 3 consecutive days of intense radiation. After I was placed in the vault, the CyberKnife rotated around my body and zapped the tumor from 56 different angles, while I lay perfectly still on the table. After I finished those 3 rounds, more chemotherapy treatments were given. And again, I'm grateful to say that I've been cancer-free for 3 years. There were so many side effects during these chemo treatments: nausea, loss of taste, eyes watering, hives, loss of fingernails, and loss of hair. And some of them continue: neuropathy of the feet and the hands, less energy, Of course, anxiety over another relapse, and loss of hair, which never returned after the second series of chemo and radiation. After relapse, I sought a second opinion, especially regarding new protocols, new drugs, anything I could do to prevent yet another relapse. Both my primary doctor and the second opinion doctor agreed no additional treatments were available or recommended. So every 3 months I review the CA-125 blood test with my doctor, and they have been normal since the CyberKnife and the chemo almost 3 years ago. Education and awareness are not enough for this disease. Research and cure are the answers, and I'm passionate about doing whatever I can to prevent even one more woman from getting a late diagnosis. And there are 3 points I would like you to remember. Number 1, this is a psychological as well as a physical disease. The treatment, the side effects, the anxiety of relapse, and the dismal outcomes make ovarian cancer so difficult. It's necessary to treat the whole person, to provide support, and most important, hope. When experts share information, outcomes are often different. Getting professionals to speak to each other and to share information can benefit the patient and the treatment. And lastly, until a reliable test is developed, early detection is the key to save lives. By listening to your body, by asking more questions, by being your own best advocate, the life you save may be yours.